This is In Step with Compliance, a podcast by the Modern Practice Solutions team for dental professionals.
Welcome to In Step with Compliance, produced by Modern Practice Solutions. My name is Olivia Wan, and I'll be your host. We're really excited to bring content to our listeners that's so pertinent for OSHA compliance in dental practices. Our very own Caitlin Dennison has reviewed some of the common OSHA violations based on what we're seeing as we conduct these mock audits. And Brenda, as well as Terry, will be providing you insight on what we see and how you can avoid these common OSHA violations. Caitlin, can you get us started and discuss with us what you are seeing when you're doing some of these mock audits?
Most common issues we see during our audits is a lack of training or improper training documentation. A really big one here for a dental practice or any other healthcare facility is your bloodborne pathogens training. This is required annually, and it's very important that you document that all of your staff have attended this each year and document the topics that were covered. The bloodborne pathogen standard details exactly what this training needs to cover. Some of these topics include how bloodborne pathogens are transmitted and information about the hepatitis B vaccination.
Caitlin, one of the things that I remember addressing with a client is that they had a sales rep to come in and conduct an OSHA training. And it may have been great. I don't know. But the problem was OSHA cited that the roster wasn't compliant because they simply passed around a sheet of notebook paper and everybody signed it. So can you elaborate on an OSHA compliant roster?
Yeah, while it is important that everyone who attends the training documents that they've attended, so a name and a signature, we also would like to see the topics that were covered. It's important, again, that you cover each of the topics outlined in the bloodborne pathogen standard.
I think that's the key right there is that, your course has to meet the requirements of the law. And then how do you prove that? So if OSHA comes in and audits your records, they're going to look at the topics that were discussed during the training session. And Caitlin, I've also had an office cited because 3 of their hygienists didn't list RDH. And that seems like such a simple aspect of compliance, but the OSHA inspector had it in the notes that they did not list their designation. So that's why we're such sticklers when we are doing training, whether it's video-based or live Zoom or in person, that the roster detail the topics as well as the participants listing what their designation is. What else are you seeing, Caitlin?
So another common issue that is frequently cited by OSHA is a lack of exposure control plan. So your exposure control plan is essentially the document that explains to your employees or to an OSHA inspector how you are adhering to the tenets of the bloodborne pathogen standard. It's like the document you make to go with the bloodborne pathogen standard. And this document needs to be updated annually. So if you have an inspection, this document needs to show via, for example, an update date on it that you've been reviewing it each year. And it also needs to be readily available for employees to view. So make sure when you're storing this program, you're storing it somewhere accessible to employees. And you'll want to make sure that if asked by an OSHA inspector, your employees could easily go grab this program. They know exactly where it is.
Good points. Remember working with a dental practice that was cited by OSHA, and some of the citations included that it wasn't current, didn't have a current date on it. And when the inspector asked the employees where the policies were maintained, they didn't know. So they were cited because the plan wasn't accessible. So really good little pearls of wisdom there. Any other things that you're seeing commonly?
I think those are the top couple for bloodborne pathogens. You'll also want to make sure when you do your training each year, that's a great time to include your safer medical device evaluation. Each year, you need to select a device that might help better protect your employees from the hazard of bloodborne pathogens. And then you'll evaluate that device and decide if you'd like to implement it in your practice. So your OSHA records or your training records is a great place to keep this documentation as well.
Good point. And that's really a great time to do it while everybody's assembled. Can you talk a little bit about mishandling exposure incidents?
Absolutely. There are several requirements for the employer if an employee has an exposure incident. So, when we say exposure incident, we mean your employee has potentially been exposed to blood or other potentially infectious material. So, this might be a needle stick or a stick with a dirty scalpel or a splash to the eyes or other mucous membrane. And if this occurs, you need to ensure that you're following each of the steps that the bloodborne pathogen standard outlines. These include offering your employee a post exposure evaluation. This is a visit to a predetermined doctor's office where the employee will get some baseline blood work and then follow up at regular intervals to ensure they haven't contracted anything. You are also required to attempt to obtain consent from the source patient, so whoever's blood or bodily fluid was involved, to have them tested for Hep B and HIV. When you go through all of these steps, it's really important that you document that you've walked through each of these steps and save any files related to this exposure incident in your employee's confidential and securely stored medical file.
Wow, you walk through that very concisely. Mishandling exposure incidents, not only, as you pointed out, is it an OSHA violation, it could compromise the safety of the employee. And I like how you mentioned that it's a predetermined place to handle incidents. We don't wait to the last minute. We don't send an employee to an emergency room where they sit for 9 hours. So this has to be handled ahead of time.
Mm-hmm.
So Terry Walker has spent a lot of years in the field going into dental practices and now continues to consult with clients. Terry, what are some of the things that you observed over the years that constitute some common OSHA violations?
The most common one that I would see would be the sharps containers. They would either be over full, because the fill line is really about 2/3 of the container, or they would have it in the inaccurate position. It might not be easily accessible. It could easily tip over. It might be in the clean section in central sterilization. I mean, it has to be easily accessible, within 36 to 52 inches off the floor. And that's one of the most common ones. And I was just at my medical doctor's office yesterday and I noticed their sharps container was over full and I was like, ooh. Violations.
So those are good points. The sharps container, and it's so visible, right, Terry?
Very
it's visible that it's out of compliance. I remember one year I was walking through a sterilization area and the sharps container was on the floor. And I asked the assistant who came through, I said, well, what happens if I accidentally kick this and there's sharps that come out of the top? And she goes, oh, that's happened. And what I do is I get my utility gloves and I put them all back inside. I'm thinking, okay, well, I'm glad it was just me and not an actual OSHA inspector. So we want to put it in a place that it's away from tipping over or running into it. And I think utilizing wall mounts is the best use of space because it's not taking up valuable countertop space. Terry, what about hepatitis B vaccines? Did you see any violations in looking at medical records?
Quite often they would come up because the practice may have offered the vaccine to all of the employees that had a potential risk for being exposed to blood, saliva, or other potentially infectious material. They would offer it, but there was no documentation that showed that they offered. So the employee has to sign a consent saying, yes, I want to have the vaccine, and then they follow through and receive the vaccine. If for some reason the employee refuses the vaccine, then they're going to sign a declination statement saying it's been offered to me, but I'm declining it. And you don't have to fill out the reason why, but the most common reason is they've been vaccinated in the past. They may have religious reasons as to why they don't take vaccinations, or there could be a medical condition where it's not in their best interest to have the vaccine. Whatever the reason is, you have to fill out the declination form.
So the declination form has to mirror the language that OSHA sets forth, and it makes it clear that it's been offered at no cost to them, and they can change their mind.
They can.
So very important to have that in the file. Terry, what about a hazard communication program? Do you see that that's been problematic?
That's a huge, across the board, quite often offices do not have a current safety data sheet. They might not have the one that is specific for their product. Or they might be in a cardboard box on the floor, where all of our SDSs are here. And as I would look through them, there'd also be MSDSs, which are inactive
Right.
currently. And, the SDSs might be on the top, but they're not organized and they're not easily accessible. So if an employee spills a chemical, they need to be able to access the safety data sheet so that they know how to clean that chemical up safely. So what products do they need? And so if you cannot access the safety data sheet, then you're putting your employees at risk.
Right. And so with the hazard communication program, they're missing a written plan. And then, as you said, Terry, they're missing the current collection of the safety data sheets that correspond with what's in place. And I think you make a good point because, like, what if they're using Cavicide and they have the safety data sheet, it's on the chemical inventory, and now they order a different product line because it's on sale. And if OSHA walks in and asks for the safety data sheet, and now this sheet doesn't match what's actually in use. And we see that all the time. And so one of the things we discuss, or at least I guess it's a little bit of an opinion, but an opinion based on saving time, is figure out what you like using and stick with it. Brand loyalty. Because when you swap up because something is on sale, we may have disrupted our safety data sheet collection. We've disrupted the chemical inventory. We might have to swap out chemical ID labels. So saving a little bit of money may not be saving money at all because of the labor time that has to go into it. And then technically, we're supposed to provide training on these new products that we implement to our program. So thanks for pointing some of those discrepancies out. And Brenda, while we're on the topic of secondary container labels, can you talk to us about those pictograms and maybe even talk about your work history that you've been in a position that you've had to be responsible for this?
Yes, absolutely. So it's important, as we know, that we have the responsibility as a practice to label any secondary containers of chemicals. For example, if we pour the isopropyl alcohol from its original container into a smaller container, we must label that smaller bottle. And so the labels are very important because, as you mentioned, the pictograms, the labels show us what pictograms represent the risk level of that chemical, possible cleanup of that chemical, even possibly what protective equipment we should be wearing with that chemical. So it's very important that when we're transferring products from one container to another, that we get them labeled properly and that we have the safety data sheet available for those products as well.
And I think a good tip is to put clear tape on top of the pictogram so it almost laminates it against moisture. And because how many times have we been on site and we're looking at a label and it's illegible because it's smudged off? So be mindful of updating those labels and making sure that the information is current. I know this year we've made a special effort to provide additional focus on this topic, Brenda, and that's the use of safety glasses.
Yes, safety glasses must be worn by everyone when we're performing those tasks that could cause a splash or spatter or flying debris to our eyes. And it's important to remember that safety glasses do come in different sizes. So we must have the appropriate safety eye care for each team member. Maybe we have someone who's very petite, and so we don't want to have an extra large set of safety glasses for that particular employee. But again, safety glasses are the one tool we have that can protect our eyes from the splatter. And there are so many different variable options out there when it comes to eye safety, right down to, newer side or under shields that have been developed by some doctors to protect that gap under the safety glasses.
Caitlin, with your background as a OSHA inspector, can you mention what the ANSI standard is and what that means, and how does OSHA acknowledge it?
Yeah, so ANSI sets standards for PPE, sort of the basement standard for what our PPE needs to do to be appropriate. So an example of an ANSI standard when it comes to eyewear, if you think about those side shields you might use if you wear eyeglasses and you'd like to continue to wear your eyeglasses, but you want them to be a little bit more protective, they make little side shields that you can affix to the side of those glasses. Well, those side shields still have to meet the ANSI standards for protection, for protective eyewear. A couple of these standards include being firmly affixed to the glass, they can't come off easily, and that side shield has to come at least halfway around the circumference of the lens to provide appropriate protection.
So it's interesting that a dentist at the Tufts University School of Dental Medicine was part of the research and really spearheaded the research in advocating new safety standards for eye protection for both dental professionals and patients to prevent eye injuries. And this led to the new standard, which is ANSI Z87.62-2021, and it addresses the bottom gap where debris can enter the eyes even with protective eyewear. So what may have been approved for use prior to 2021 no longer meets the ANSI standard that is current for today, with the research that was done and adopted and updating that ANSI standard. So just want to emphasize the importance for our listeners to make sure that they are following the current ANSI standard. Anything else you'd like to add to that, Caitlin?
I think that's a great point about that study. I believe one of the statistics from the study was that debris from doing a dental procedure can fly as fast as 50 miles an hour. And so I always use that in my training to remind people just of the intense impact that could occur doing what might at first seem to be a relatively low hazard dental procedure. So your eyewear is just so important, and we want to make sure that it's as protective as possible. And remember, if you are an employee, it is your employer's job to provide you free of charge any PPE that you require for your job. So that includes eye protection. So if your eyewear doesn't fit appropriately or you need more protective eyewear, that's something that is within your rights to bring up with your employer.
And that leads me to another thought, Caitlin, that and maybe Brenda and Terry have run into this too, where I was working with a pregnant employee and her lab jacket did not fit. She couldn't close the lab jacket. And so I had to put that in my follow-up report that the appropriate PPE needs to be selected and also the right size. So not just the eyewear safety, but also the protective clothing. And I think Brenda touched on that as well. Like, if someone has a very small, tiny face, it may be difficult to get the right size safety glasses or mask. But getting back to Brenda, talk to us about utility gloves. I know that has been an area that we are always harping on, so to speak, when we're working with clients. What's your take as you're working with clients in this compliance arena? Do you see that as a problem?
It is. And we joke about that a little bit in our training. I always say that let's talk about those utility gloves that we all love to hate. Yes, utility gloves are bulkier, but they serve such an important role. Utility gloves, we're wearing them when we're handling contaminated sharps, when we're handling contaminated or we're disinfecting contaminated countertops and instruments and things like that. So your utility gloves are your line of defense to making sure that you're protecting yourself from a sharp's poke while you're doing those procedures. And again, utility gloves do come in different sizes. So we want to make sure that if you have team members who have more petite hands or team members who have very large hands, that they have utility gloves that fit them appropriately, because you certainly don't want a very petite team member using an extra large pair of utility gloves and having all that gap, which then just makes them susceptible to, contamination.
Good point. And I think, that just talking about these topics among the four of us, all of us are trainers. And I think it resonates with the listener on how important it is to do training. And we entitled our course this year for OSHA infection control, Compliant or Complacent. Because true, that's what we run into, that, either we're getting into compliance or people have heard it over and over and over again, that they start tuning it out. They become weary. They become calloused and complacent. So if you haven't already scheduled your training for this year, please reach out to Modern Practice Solutions. You can visit our website, modernpracticesolutions.com, or give us a call, 931-232-7738. And you can schedule with one of our trainers. We offer video that's pre-recorded, as well as live Zoom and live and in person. And so we encourage you to get that on your appointment book so you can avoid some of these common OSHA violations. And I can assure you, regardless which trainer you're assigned to, all four of us have such a strong background in compliance and in dentistry as well. So thanks for tuning in to this episode of some of the most common OSHA violations that we see in dentistry. And we look forward to seeing you next week.